Welcome to this week's Health and Care update on the coronavirus pandemic in Devon. We are still seeing cases rising in Devon on a daily basis, particularly across the working age population and the very elderly. I'm now going to hand over to Simon Chant, who will give you more information about the data for Devon.
This is an overview of the latest national and local data on COVID-19 as of Thursday, the 14th of January. We start with the national picture. The increase in cases has slowed nationally, although there is substantial regional variation. The number of tests conducted has increased significantly. Nationally, there has been a 54% increase in the number of deaths over the last week. Now for the local picture. In Devon, for the latest available week, there were 1,786 COVID-19 cases and 31 deaths, with rates of both below the national average. Case rates are slightly higher in Exeter and Mid-Devon. Cases of COVID-19 have continued to increase in Devon, with cases currently rising on a daily basis. Case rates have increased over the last week for those aged 80 and over. The data in this summary is drawn from Devon's COVID-19 dashboard and the National Coronavirus Tracker, where the latest available information can be found.
Thanks, Simon. As you can see from the figures, the rates in Devon are the highest level since the start of the pandemic. Please follow the rules, stay at home, and only go out if you really need to. For example, because you're unable to work at home or you're going out to get some essential food. Remember, every time you leave the house, you risk coming into contact with somebody who has no symptoms. You could be touching a surface, a petrol pump, a shopping trolley, which could be contaminated. And this could be a crucial link in the chain of transmission, which could end up in you or someone you love being seriously ill or unfortunately dying from coronavirus. Don't forget, if you do go out, please follow the rules. Maintain your social distancing, wear face coverings if you're indoors in a public place, and please wash your hands regularly. I'm now going to hand over to Dr. Paul Johnson from NHS Devon CCG.
So you've heard the start message from Steve and Simon. Although Devon has relatively low rates compared to other parts of the country, we're still seeing cases rise and we're still seeing more people going into hospital. It's therefore really important that we don't let our guard down. So please stay at home where you can and follow all the rules to stop the spread of this deadly disease. Vaccination is the way out of the lockdown and of the pandemic. It's the best way to protect people from the coronavirus. And we have a plan, and we'll get all of those people who are at risk vaccinated, and we'll be contacting you when it's your turn to get the vaccine. Thousands of people in Devon have already received the vaccine, but this is a marathon and not a sprint. It will take time. The good news is that both the Pfizer and the AstraZeneca vaccines have been through rigorous tests and approval processes, and they have been proven to be safe and effective. Therefore, when you come for your appointment, you will get a vaccine with proven effectiveness, but we won't be offering you a choice of which one you get. There are 3 ways we're getting the vaccine to you at the moment and a 4th coming. Firstly, all 4 of the country's main hospitals in Plymouth, Exeter, Torquay and Barnstaple are giving the vaccine to priority groups. Secondly, our GP practices are working together in groups to set up local vaccination centres. Thirdly, our GP-led facilities are visiting care homes and delivering the vaccine to residents and care staff. You will have heard on the news that large-scale vaccination centres serving wide areas are also planned across the country, and we in Devon are making plans for these sites to be extended here in the near future. So how can you play your part? There are 4 main things that you can do to help the NHS give the vaccine to local people as quickly as possible. Firstly, choose the right service for your needs, as GPs are now managing extra pressures from the vaccine programme. You'll still get a face-to-face appointment at your local practice if your GP thinks you need one. Secondly, if you have an appointment, attend it, whether it's for your vaccine or to see your GP or at hospital, unless you have been contacted and told otherwise. Thirdly, keep your hospital and GP phone lines open and available by not calling them about getting the vaccine. We will contact you when it's your turn. And fourthly, follow the government rules. The vaccines are a wonderful development, but we're not out of the woods yet. Please stay at home where you can and follow all the rules to stop the spread of the virus. Immunity takes weeks to develop, so act as if you have COVID even after you've been vaccinated.